everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Niraj with us. With his exceptional experience in endodontics and conservative dentistry, he's here to guide us about guided endodontics, a subject that he has read in depth, a subject that he has had deep research in, as well as published a book into. He has had a multiple experience of being an international speaker on the same topic, as well as guided so many students out there to understand guided endodontics, a subject that is less spoken about. So he's here to talk about us and help us understand how can we implement this on an everyday basis in our practices, and how can it help us with our practices as well. Welcome, doctor, to the platform. It's really nice to have you here.
Thank you, Dr. Ayushi. That was such a power-packed introduction.
Yes.
Thank you for having me.
I'm really happy to have you here. I'm sure, this discussion will definitely make some practices to go in the right way. So, yes. So help us understand, how has your journey been till now into endodontics, and, how has it been till now?
Dr. Ayushi, to be frank, my journey has been like the journey of any other fresh endodontist. I started my career with consulting endodontic, visiting different practices and just roaming throughout the city for endo treatments. That's how I began my journey way back in 2012-13.
Okay.
During my post-graduation. And after that, eventually I moved into my practice. The first practice was a rented one. Then I decided to invest in microscope. I started my microendodontic practice. And now I have my two practices in Ahmedabad in two good areas and localities. So that's how I started my journey.
Yes. So now, you have been into something called as digital endodontics, and I have seen you giving multiple lectures also on that. So what exactly is this, and how is actually this space evolving? Things have been evolving really fast now. So how do you see it evolving since the time you passed out your post graduation till now? How do you see things changing?
I feel that the digitalization has been changing the way we live our lives. I mean, can you imagine your life, a single day without digitalization in your life? When I used to do my post graduation, it was the time where the Android and iPhones were just coming in. Before that, I was with BlackBerry Torch. I was using BlackBerry mobiles, and now we are using iPhones and Androids. So that's how significantly the life has changed within the last 10 years. And talking particularly about digitalization, it has not only changed the way we live our life, but again, the way we treat our patients in medical and dental profession. And when you see that some technologies can change your patient's life for better, the adoption of the technology would really be easy and quick. Particularly digitalization in endodontics, on which I have been lecturing for last couple of years. Endodontics, I feel we were the first branch who adopted technology. Apex locators or endomotors, right? They are prevalent since like 1962. If you go through literature, the first apex locator was there. And it has really changed the way we practice in our daily lives. So that transition from the conventional radiograph to digital radiograph, right? Things change, and it's just the matter of time that clinicians are open to transform their practices with digitalization.
That's true. Things have been evolving and drastically changing, especially endo. I completely agree with this. So now, as our topic is on guided endodontics, so first let's understand what exactly is guided endodontics, and how do you think it will change the practice in general?
So first, what is guided endodontics? Right. There are many names for this thing: guided endodontics, targeted endodontics, having templates with endodontic treatments. Various peoples know it with various names. I have been in contact with my colleagues from Brazil or Germany or France or Australia, and you will find it strange, but everyone is working on these topics, but they just call it with different names or the different approaches.
Okay.
Right. And second, why guided endodontics? So first thing, all our treatments have always been guided, because as a dentist, we have never believed in blind dentistry.
Yes.
Whether we are doing implants or we go for root canal or even the simplest extraction. When was the last time, as a good clinician, anyone decided that let me just go blindly and complete the treatment? No. We always like to be guided. Either it is your brain guided or you like to get guidance from the radiographic images.
Correct.
So that is known as image guided dentistry. We are much more dependent on our two-dimensional radiography.
Correct.
Right? But with the invention of the third dimension, CBCT, it opened another door for dentists where we can explore more opportunities, what things can be done with it. So what CBCT has incorporated is that now as a surgeon, we can ask few questions. First one is, where is my target area? If you want to jump into a surgery, whether it is medical or dental or any field, be it,
yes,
what is your anatomical target area?
Yes.
Second question is, how precisely and safely I can reach my target area? Right. Another question would be, if my instrument is going inside, where is it exactly? How precisely in real time you can locate your instrument inside? Whether it is abdominal surgery or dental surgery. It's very important to figure out this question, right? And if as a surgeon you can address all these questions, you have mastered your craft.
Correct.
And that's where the guided treatments come into play. So it all began with neurosurgery, because they are playing with small neurons. They have to do very delicate surgeries. So that's where this entire science developed. And then gradually it evolved into implantologist, because they started doing prosthetically driven implants. They want to make sure that their implants are at proper positions. And then we adopted it from implantologists, that how can we localize our endodontic instruments inside the tooth? And the prevalence amongst the dental practitioner will increase, because every clinician gets one patient in a month or once in a while who is so much determined to save a particular tooth, no matter what effort it takes, but they will say, Dr. Saab, ye daant bacha do. I want to save this tooth at any cost. I don't want to go for implant or extraction. Can you make an attempt to save it? Right? And that's where the guided treatments will give you that last shot. So whenever we are dealing with upper molars or lower molars, teeth which are near to anatomical structures, like there is a molar which is very close to maxillary sinus. Let's talk about maxillary second molar.
Yes.
Or if you talk about mandibular first molar, which is having just 3 mm distance from infraalveolar nerve.
Correct.
This type of cases where, as a clinician, even microendodontist, people hesitate to go for episectomy. If your tooth is periodontally sound, and normally clinicians think, let's remove this tooth and go for implant. But this treatment or the concept will give you one option to save the tooth, and that is the episectomy, where you can safely, precisely remove only that part of the tooth.
Correct. No, that's correctly said. This is something that can actually help so many cases and so many cases where we can restore teeth. That is very important. So now, when you have mentioned that, how can it help on an everyday basis, the dentists? What do you think are the instruments needed for this? What are the instruments basically needed for somebody who wants to start using guided endodontics on an everyday basis with some of those patients who are very choosy that you mentioned?
Yes.
What instruments will you suggest for a new dentist to pick up and to invest into, and how they can subsequently get better at it?
I feel to begin with, there are two parts of guided endodontics. One is static, one is dynamic. Okay. When I say static, that means we are using 3D printed guides. And that is a bit cost effective. We can as a beginner, one should start with the static guidance.
Hmm.
Dynamic guidance means we are investing in a gadget or fancy machine which will cost a lot.
Hmm.
So that can be the next step in your clinical practice. But as a beginner, one should invest first in good armamentarium. And when I say good armamentarium, that can be even the loops, because this guided treatments are incomplete if you're not using magnification.
Okay. Hmm.
Both the things address different question. So if anyone wants to start with guided, all you need is simple DICOM data. You need a CBCT of a patient
Hmm.
and a person or a radiologist who is going to plan the treatment for you.
Hmm.
So I will just explain the workflow. Okay. The first step that is needed is DICOM data, which is called CBCT data.
Okay.
Second one is the impression of the patient. Let's assume that Dr. Ayushi wants to do episectomy in lower 6, mandible of first molar. Then first thing that you require is CBCT, and second you require is impression of that area. It can be your conventional putty impression or the digital scan, anything would do. And after that, you just need a guy who can go online and plan a software for you. And that's where we come in. We do that part for you. We help you to plan your treatment. And only thing that is needed is a small trephine. So most of the times, these trephines have been used for implants.
Okay.
Now we're using narrow diameter, 1 millimeter or 1.5 millimeter trephine. And most of the times, even we suggest it to clinicians because every clinician who wants to start, they don't know what instrument to purchase.
Correct.
And it doesn't cost much. It hardly costs a couple of ₹1,000.
Okay.
That's how the journey can be started. And it is not only about the surgical part. Even with the calcified canal for the non-surgical treatment, you can use guided endodontics. Those are the simplest cases where you can implement this technology. And all you need is a small burr with long shank, right, which are easily available from different companies. So that should be the starting point for everyone who wants to apply this digitalization into the practice. But the key to success is a good case selection.
Okay. Okay. And what do you suggest, when you mention good case selection?
Yes.
What is the easiest and the, clear-cut case that you think a person should pick up as the first case to start with guided endodontics?
The first case that can be picked up is upper anteriors, maxillary incisor. Most of the cases where we see calcified canals are anterior tooth.
Correct.
There are so many people who met with traumatic injuries or accidents and the front teeth are damaged, they become non-vital, and eventually there is some calcification in the coronal part. Right? So these are the cases which should be, as a beginner, you will always gain your confidence by doing such type of cases. And it may sound strange, but no matter how confident we are, but even maxillary anterior with calcified canal is the most difficult case to deal with.
Okay.
So this type of cases one can select to begin their journey with guided endodontics.
Okay. So now, now when you mention that maxillary anteriors are something, so anything else that you want to mention, that people should take care while trying to practice that? Should somebody do some kind of courses before implementing this in their practices, or do you think that anybody can do that? It's just planning things accordingly.
The main advantage of digitalization is that even a beginner can do the treatment equivalent to an expert. Okay. That is the biggest advantage of digitalization.
Correct.
So in my opinion, every beginner can start directly with this type of treatments.
Okay.
The only thing that you need to check is interocclusal distance. You have to check what is the mouth opening of your patient, because when the 3D guide comes in place, in order to use the long shack or long neck burrs, you need proper mouth opening. If mouth opening is not sufficient, that won't be the ideal case for you. So if you can just check that criteria, any beginner can start right away with this type of treatments.
Okay.
Yes, the surgery, the surgical part, it requires some more experience. And I always say, if you want to learn microendodontic surgery along with ConsAsia, we are starting this type of courses in India. you need to at least go through basics, because you can't take risk with the vital structures. First, you need to do that on models several times. And once you master within a couple of days or couple of model surgeries, then you can go for the actual surgery.
Okay. Okay. No, this is correctly said. Surgical part needs experience, definitely. So something now with guided endodontics, anything from your end for the endodontists right now who are studying, who are just out in the market to practice, what is your suggestion to them? Should they start it from the start beginning? Because this is something not taught in the colleges in your post-graduation. This is comparatively new that you start implementing in your practices. So what is your suggestion for them at this time?
So the best time to start with guided endodontics is your post-graduation time.
Okay.
Because you have the chance of doing some trial, error, and learn new things.
Yes, yes.
Nowadays, at the time when we are talking, within last 6 months, there's almost the end of May.
Correct.
In last this months, there are so many international publications on guided endodontics that now even the academician, the PG students and PG teachers are motivated enough. We get many queries from different postgraduate students and even the PG guides from different colleges. They want to incorporate that guided thing into their college. And that is the right time. The only thing is students should be motivated to learn something new. For this generation who are already into their post graduation, they should always think that what else they can incorporate into dentistry. Correct. What is new that you can do for your patients? Everyone is doing conventional dentistry, but what is something unique about you that you can bring into your field? You are passionate about it. And in PG, usually, if you want to do something new, first you need to be motivated enough, right? Definitely. If you have the desire of doing something new, you will end up doing new things.
Yes.
And that's how we all started.
Yes.
Right. So just keep that fire inside you burning, that you want to learn something new and incorporate into your patients. It all starts with the thinking, right? Correct. First, you need to visualize and think. And for that, I think reading is very important. Keeping yourself updated with the latest literature, which is published in international journals. That is the right way to start your journey.
Yes, yes, that's so correctly said. And I also wanted to ask, apart from this, because you have also been reading when you mentioned international literature. So what is it apart from guided endodontics, something that is coming up new that you will suggest the, fresh graduates to start thinking, reading and practicing?
For fresh graduates
or postgraduates. So when I mentioned, right, for the postgraduates who are studying right now,
right?
This is for the postgraduate. What do you think these endodontists should also understand apart from guided endodontics? What are the topics that are new coming up these days that they should read about?
Yes, so guided endodontics is at the forefront. Apart from that, there are good topics such as now there is many new gadgets for instrument retrieval. And most of the times where you are practicing your endo practice, people only refer you cases whenever there are instrument breakage or such type of complications.
Correct. Correct.
So every fresher postgraduate student should learn more about how to remove or deal with these instruments. And another good part is evolution of bioceramic. You will read a lot of literature on new bioceramic materials, the way they are transforming dentistry. Because in endodontics, there are so many complications, be it perforation, canal transportation, instrument fracture, episectomies. But at end of the treatment, we always want to give a good seal in that area.
Correct.
And for that thing, bioceramics are unparalleled.
Yes.
So PG students should also focus on those lines. Third thing that I can mention is learning how to visualize CBCT and how to analyze it. Most of the times we're dependent on radiologists that please interpret this data. Tell me what is this thing? Is there any extra canal?
Yes.
But it's very important that we ask for DICOM data and we learn how with different softwares we can analyze it on your own. Because sometimes some other people may not do that much hard work for you as you can do for your own patients.
Correct.
And it's very small thing, just analyzing CBCT.
Hmm.
It can add a lot to your practice.
Correct. Correct. So correctly said, all the 3 points. So now when discussing about the postgraduate, there are a lot of things for the graduates as well. The BDS people who have passed out, and endo is like bread and butter of dentistry. This is every second case ends up into RCT. So what will you suggest for them to be better clinicians, to be better with their practices and their patients? Something that you have seen very commonly mistakes done by the graduates that you suggest they should do to avoid all of those?
I think the first thing that any recently passed undergraduate student requires is motivation and proper guidance.
Correct.
Because I am also associate professor at Karnavati University. I am into teaching, and most of the students whom we interact with these days, they are not motivated enough sometimes, or they are too much anxious that what would be their path ahead in dentistry, which way to take. Is dentistry worth their time and effort? Will they be able to make money and earn their bread? When we say bread and butter, but in routine life, now we know how much the field is getting saturated, and the freshers are so much anxious that how are we going to survive in this?
Correct. Correct.
So for that, I would like to address that part first.
That will be great.
Because when you are just completing your undergraduation, you already know that there are thousands of dentists in the market. The field is already saturated, and that's why you need to learn something more. When it comes about learning, it's also about widening your horizons, thinking in different direction. We have now second year undergraduate students who are performing a research on a particular topic. The seeds of doing something different can be fed at the time of inception of your journey in dentistry, and it's never late. Whether you are in internship or you are done with it, think in different areas. There are different things in dentistry which you can explore. You can either be motivated for clinical dentistry, you can be motivated by research thing. And let me tell you, if you're good at research, it is equally or even higher paying than what you can earn as a clinician. Right? The initial struggle will always be there for any of the way you take or choose. The third thing that people are not so much aware or they're not inclined towards is sometimes exploring that how to go into government jobs or army jobs, and that is the area that has to be explored. But I will keep my focus mainly on the clinical and research part for this conversation. When it comes to clinical part, again I come back to digitalization. When you're fresher, you don't know what is digital impression, what is CBCT, how, and only knowledge that you get is from the company. Because we are living in era where rather than our national dental body counseling you, you are getting more teaching online. So if you want to learn about digital scanner, you will know only about one company digital scanner or two companies. You don't know actually what is the concept, what is their acceptance and accuracy. So try to go for the courses which give you unbiased knowledge which is not biased by any particular company. Then only you can evolve as a good clinician.
Correct.
Second thing, keep on reading new things. And when I talk about reading, it is the latest journals, and not even journals, sometimes even online dental tribune or many magazines. Dentistry has so many magazines now. You go through that and learn new things that what is in these days. Because different areas have different needs. If someone is in Middle East, they may have different area to focus on. In India, they may have different needs.
Yes. No, these are correctly said. Now, when you mentioned that, to go not to go for sponsored courses and to not to go for courses that are, that are normally done for marketing, and everybody understands that. So how can people actually find that? So this is something I must tell you, maximum courses in dentistry, what I have seen is to are done by companies or by the people, and the people also, they are mostly sponsored by the companies. So to find courses of that kind and to end up is one difficult task as a fresh graduate, because you are actually, when you mention you're not clear, and then maximum time you find these kinds of courses. Other thing also I want to ask is, what are the courses that you suggest, especially in endodontics, that a fresh graduate should learn after graduation?
Okay, I'll address both the questions. Number one, uh, unbiased courses, how to opt for that. So there are few organizations which are international. They
Okay.
are not biased by any company. They are just science-driven organization.
Okay. Okay.
To just name one, there is an organization called Digital Dentistry Society.
Okay.
You just go online and go to dds.org, and this digital dentistry organization, they also have their journal which is indexed with Elsevier and PubMed indexed. They are doing organic research with digitalization. So they also compare 12 different company scanner, and without any bias they will tell you which one is better, which scanner is good for orthodontic, which scanner is good for a prosthodontic part, whether you should use scanner for full mouth implant cases or still putty impression is a better option. So actually, if you go through literature, what I just concluded in this last 2 lines, it will take you 2 days or 2 weeks to read that stuff.
Correct.
But that's how this unbiased stuff works. If you go through that, they will give you the right answer. And now the reach is increasing gradually in many countries. But unbiased courses is very difficult to get, but at least you should find a clinician, a good mentor who can guide you in proper direction. If I'm conducting a session for a particular company, definitely I will endorse that particular brand, right? But at the same time, I should be unbiased and give you other options and a broader understanding of that subject as well, so that you can go in whichever direction you want to. It's like I am having my Mercedes, but I can't ask you that, okay, you invest 40 or 50 lakh rupees for that.
Definitely.
You have come to just learn how to drive a car, and then it's up to you whichever car fits into your budget. You should be able to drive that.
Yes.
The same goes with the courses. If you have come to learn a particular craft, I have to teach you that craft in such a way that whichever company you use,
you can
incorporate that, implement that into your clinical practice. And to address the second question, in endodontics, I think the only thing which is needed in endodontics is good experience.
Okay.
Rather than courses, first invest in good armamentarium. If you think that you want to invest 40 or 50,000, rather than just opt for a course within range of 15 to 20,000 rupees, purchase instruments worth another 15 to 30,000 rupees, and start using in your practice. Because the more patients you do, more experience you get, more confident you will have.
Okay.
And the confidence is the only key which help you as a clinician.
Right? That's true.
That's how you keep on learning in your private practice.
That's so correctly said. So, now when you mentioned that you are an academician also, so just offbeat question, from the endodontics thing. Currently, you already know, currently the graduates are not that motivated to work, and especially with the NEET not happening, even after the NEET results,
Admissions are not there yet.
The interviews are not happening. There is nothing that you cannot see what is going to come up. Nobody's sure. In fact, the current graduates also do not know when to prepare or not to prepare for the NEET, because already the previous one is also not being taken care of. So what is your suggestion for them, even for those people who want to pursue dentistry but especially are very unclear because of the current situation?
I would first I would like to empathize with all the students who are stuck in this difficult times.
Yes.
These are really difficult times when there are no clear-cut guidelines or instructions from the governing authorities what are going to be the things next. But at least the students should try their best to keep themselves motivated. When I say motivated, just there are two ways of keeping yourself motivated. Either completely distract yourself in some other direction, keep yourself engaged in either doing the humanitarian work, helping needy peoples in these difficult times, or either focus on learning dentistry online, because that's the only way how you can keep yourself motivated enough. you are definitely going to get admission. It is matter of couple of months. Now, as COVID cases are going down, government won't be able to hold it back for more than 1 month. By July, we expect that things should move forward. But yes, I think it's difficult to comment on the governing authorities.
Definitely.
But for students, these are demanding times. They just need to stay strong, and we all are in with them in these difficult times.
Yes.
Just keep yourself engaged somewhere and think in that way that this is the only time where you are free in your life. You are not going to get this type of quality time again.
Ever.
So
Never.
rather do some craft, learn some new hobby, or just stay safe at home, but uh, be motivated enough.
Yes, correctly said. So now, when talking about motivation, what has kept you motivated always? From the start, what to learn, to read, to innovate, to do research. What is it that you do every day or think every day to keep yourself motivated?
That's a difficult question, and I think that is one of the very rare question which I've been asked. Okay, I do read a few quotes which motivate me many a times. And if the students who have been attending my lectures, usually there is one quote which I quote at the end of my every lecture. Uh, Success belongs to those who believe in the beauty of their dreams. So that is the only thing which always keeps me going. I just try to explore new things, dreaming new things, and then I try to chase my dream. Right. And I always believe that our life is too short. So just take your chances, never be afraid or hesitated enough to ask anyone anything.
Correct.
Most of the times, the biggest gap in our life that comes when we think, we dream about things, and then we don't implement them.
Yes.
So implementation is the biggest task. And I always feel that one should not be, I don't know how will it sound, but one should not be afraid of a failure. Because in our society, we always feel that people tag you as a failure. If once even you slip in your life, you're not doing something right, they say, okay, you failed. And it has happened with me. If some student comes to me for the treatment, endo treatment of the parents, and they will have very high expectation that I will save that tooth, right? But we need to be realistic. You can't be a hero every time. You can't deal with the nature.
Yes.
If something fails, it will fail.
Yes.
So just don't be afraid of failure. Keep chasing your dreams. Keep doing new things, and there will be something at the end of the path. You will get what you want.
Correct. That's so correctly said. Two very important things: to dream and to implement something that leads to what you want. So, and we can actually, you are the live example of that.
Well, thank you for saying that, but I can, rather than dentistry for this philosophical part, I can go on and on for like hours, because I like always motivating people for this thing, that just don't be afraid, take that leap of faith. You don't know when miracle happens and you get your chance. I mean, at this age, I didn't know that I will publish my own book with world-known brand,
Correct.
a good publishing house.
Correct.
But things happen. You just have to dream for it and make your efforts going in that direction. And you never know, one day you will achieve it. Right?
That's so correctly said. Actually, there are times that you dream and you just don't implement, is something that you need to stop doing and work towards your dream. Yes, thank you so much, Doctor, for this amazing, insightful, and motivating discussion. Something that I'm sure every dentist can relate to, whether graduate or postgraduate. Understanding about guided endodontics, as well as how to keep yourself motivated every day, is something that Dr. Niraj has, mentioned. And it's simply very nice. Thank you so much for this.
Thank you for having me. It was
Yes.
such a great time.
Same here, same here. Thank you so much, everyone, for joining us today. I'm sure this discussion would have been really insightful for you. Do share it with your friends and colleagues, as well as do follow us on our Instagram as well as YouTube channels. And if you have any doubts, do let us know. We will share the email ID of Dr. Niraj with you. Thank you so much again. Keep following us on all our pages and keep connect, and we will have more live videos every Sunday. Thank you so much, everyone. Bye-bye, everyone. Have a nice day.